Hey guys, we're back again. Today we have Dennis Vaysburg on our Meet the Resident series. He just finished up 2 clinical years and is heading into the lab, so we'll be able to get a lot of good information from him about what the first 2 years were like. So Dennis, thanks for coming on. Can you tell us a little bit about where you grew up, where you're from?
Hey guys, I'm Dennis. So I actually was born in the Ukraine and came here with my family when I was like 1 year old. So I think I'm the third first generation immigrant in a row in this series. But we moved to Pittsburgh. I was 1 year old, so basically spent my whole life growing up there. Then went to Cleveland for undergrad at Case Western, then back to Pennsylvania to Temple for medical school, and now I'm in my second stint in Ohio. Here for residency.
So how many did you when you came to the United States? Was it just you, or do you have brothers and sisters as well?
I'm actually an only child, but my family kind of came all together with like my parents and a bunch of grandparents, and everyone was in Pittsburgh at the time, so we had a pretty good sized group there.
Wow, that I did not do this on purpose. It has just been the way it's worked out for the interviews.
Yeah,
That's great. So in terms of the first 2 years of residency, what would you say was the biggest change between first year and second year? Obviously, we have people who are going to be doing all of this virtually, but what do you think was the biggest difference between year one and year two?
I think you just get a lot more responsibility as a second year. I think it's appropriate. Your first year you learn how to do things, and the second year you do more call overnight where it's just you going in. You do things like SICU senior. You're on trauma where a lot of the time you got to handle things while your seniors in the OR. And I think I really like that. You kind of feel like you're more important part of the team. You feel like you're not just there doing the intern work. You feel like you're actually there's patients who you've really participated in their care and have really helped them out and kind of are the person who made some of these decisions that helped them get better.
Did you always know you wanted to go into medicine, and did you know you wanted to go into surgery? So how did those decisions come about?
I don't remember exactly when I decided I wanted to be a doctor. If you ask my parents, I think they say I always said that, but I don't know. I think sometime in high school, I liked the sciences, and I think I just kind of the path opened itself up. And I thought that this would be what I wanted to do. As far as surgery, I was in undergrad and I shadowed a surgeon. I thought it could be cool. I didn't really wasn't committed to what I wanted to do, but then I saw a couple of cases with him in the OR, and then I actually went to clinic with him. And hearing some of his patients, talk about how they got a lot better, how they're feeling better, and seeing that, kind of the progress of seeing a patient coming in with a problem, seeing the OR, seeing him do the case in the OR, and then seeing someone post-op who felt like they're much better, I felt like really solidified my interest in surgery.
Is your family, do they have any medical background, or are they in medicine at all?
No, nobody. I have a grandma who was a nurse, but other than that, yeah, no medical background. So kind of, moving here, my family moved here and I was the first one to do the whole traditional, college med school route and the first one, even be in sciences. So I had a lot of support from my parents and my family, but, definitely relied on other people like my friends or people I was in school with who were on the same path, both ahead of me and kind of the same level as me to see what I needed to do and what steps I needed to take to get where I am.
Yeah. With your background, what do you think is unique to either your family, like chemistry, cultural differences that may either give you a unique perspective or kind of shape your hobbies or what you do outside of, the hospital in the OR?
Yeah, I'd say a lot of things. I think, I'm very close to my family, which I know other people are too, but I think, they, like I said, they really supported me when I told them, these are the things I need to do to get into med school. And they're okay. We kind of, we don't know anything about this, but, we'll help you do whatever you need. And I think, as far as like hobbies and stuff, you're saying my family cooked a lot. That was like my grandparents lived really close by. They cooked most of the meals that we ate, and I think I got really into cooking, through that. And then in college, when I was gone, I needed to cook on my own. I think that's still a hobby that I keep going. Every time I'm home, I usually try to cook for my parents. Um, Sometimes I'll make Russian food that we like to eat. We liked to eat growing up. And then I like to cook for all my co-residents too.
What kind of food? So everybody knows. I know that you have this alter ego aside from doctor, but chef MD. So what kind of dishes do you like to make, or do you make? I always get, I'm not a very good cook. I don't really enjoy it that much. So I always get designated to salad duty in my household. So what kind of dishes? Salads
Salad's
are
pretty
important.
good.
Salads are
Yeah,
important. So,
yeah.
but what kind of dishes do you make? What's your favorite dish?
I make a whole lot of everything. I kind of scour the internet or cookbooks for recipes and mix and match things, and kind of whatever I think is looks good that day, I'll make. I have right now this big like 1,000-page cookbook that I'm reading front to back by Kenji Lopez Alt, who's one of our attending's favorite chefs too. So he's giving me a ton of ideas. I actually made his tacos El Pastor recipe this week
Nice.
for a
Now you're
couple.
tapping into my culture, so I
Yeah,
understand. Now we're talking the same language.
yeah, it was great. It was like this 2-day process of like getting the meat marinated and slow cooking it, and it was definitely worth it.
Oh,
Uh,
goodness. What's your
yeah,
favorite dish from back home?
um, I would say these grilled pork kebabs. It's like usually get like big chunk of like pork butt or pork shoulder and cut it up into cubes, marinate it with like it's like sour cream and mayonnaise, which doesn't sound super appetizing, but then when you get it on the grill, like all that oil gets the pork nice and crispy, and then you just toss it with a bunch of onions and dill, and it's really good. It's like the perfect summer food. I actually was planning on going home maybe because I have a couple days off and making that with my parents.
Wow, that's really great. Maybe one day I'll be able to tap into the whole cooking thing. It hasn't grown on me just yet.
Easy. All you got to do, as long as you want to make the food, I think you're motivated to have that delicious meal at the end.
Do you have a microwave? Do you use a microwave?
No, I actually don't have a microwave. Yeah, people are very worried when they hear about that, how I exist. But I think the toaster oven is a lot better in every
Yeah.
sense. Yeah, I'd never had a toaster oven before. I was a microwave person growing up, and then I made the switch in medical school, and I think I'm hooked on the toaster oven.
Is there, and the reason I say this is because we just moved and we have a
Yeah,
toaster oven as well. We use it a ton, but we've always had a microwave. We don't have one currently, and we're trying to like make the adjustment, but it just seems that maybe you can get away with just the toaster oven.
I think so. I think like liquids like soups and sauces are probably the one thing that's easiest to do in the microwave. But if you just you can put them on a pan on the stove, and it takes a little bit longer, but I think it's worth it. Yeah,
We'll give it a try. So
yeah,
going into so I know you're now going into the lab. So what are you most excited about for the next 2 years? They go by really quickly. I'm just giving you a heads up.
yeah, yeah. It's definitely a big change. It's kind of a little bit of anxiety. You're in second year, you're finally kind of hitting your stride. Feel like you're making decisions. Feel like you're getting comfortable in the OR, and now everything's shifting. But I'm excited to do more of the research, kind of get my head around why we do the things that we do, learn about kind of the basic science side of medicine, as well as I'm interested in participating in a lot of other clinical projects. I know I'm pretty involved with our surgical education research. We have some projects involving the med students, their learning and resident, as well as resident learning, which is something I kind of want to stay involved with after. And I think my research years will give me the time to kind of pursue all these other sides of surgery other than being in the hospital, being in the OR. Kind of make me better through that.
Yeah, who will you be working with?
So my main research will be with Dr. Nomalini. It'll be with trauma and sepsis. I like it because I'll be kind of tracking all of the patients in our surgical ICU, which I know she always laughs that when I'm at home, I sit and stock Epic and look at the ICU patients and see what's going on with
What you're
them.
cooking? You have it
Yeah,
up on the.
exactly. The little ICU list. So now I can actually do that as part of my work. So that'll be a lot of fun.
That's cool. Um,
Yeah.
so because you're kind of right at that bridge of going into the clinic or into the lab, what do you think was the most challenging thing to overcome during those first 2 years? And I say that because you're just coming right off of it for all of the students that will be applying in the fall, that they can look forward to that in or expect it.
I think time management is probably the biggest thing that changes from medical school to residency. I think especially early on when you're just learning the hospital, you have to simultaneously, learn the very basics of being a resident, but also, trying to read, trying to keep up with things, trying to plan for your cases. I think that was kind of the biggest adjustment. Um, and then, trying to go home and, take care of yourself a little bit. I would have to plan my meals a couple days in advance. I'd never go to the grocery store and cook on the same day because by then the food would be done too late. And I don't want to risk losing the lighting to take a picture out for Instagram. So
Yeah. So for you as someone who's really, I mean, familiar, comfortable with cooking, I know that for in residency, a lot of people kind of leave that, to the side and maybe kind of develop just easier habits that are maybe not as healthy and or as nourishing. What tip would you have for those of us who struggle with cooking and managing that part of our lives? What's
Yeah, I think
easy to do?
Yeah, I think, if somebody hates cooking, if they, don't want to do it and they hate it, I think, you'd be miserable if you're like coming home from work and you're tired and you're forcing yourself to do something you hate. I think it's important for everyone to have, one or two hobbies that they stick with, that kind of, make them feel good, make them, feel healthy. I know you run a lot. I like to try to run too when I can. Probably will happen more in the lab now than it did before. But I think just having a couple hobbies that you can look forward to doing when you get home that kind of help you relieve your stress in the day, help you kind of get your mind off of work. And I think if you can make those hobbies things that are also, self-care, I think that's important.
Yeah, I think that's good. And so, any last little tidbits for advice or how to manage the virtual interview season for the incoming applicants
Yeah.
and for maybe the third year students that are even thinking about doing surgery?
Yeah, I think it'll be tough for everyone. I think I can definitely see it being nerve-wracking for the students. But just remember that we're also doing this from the interview side for the first time. So everyone's gonna have the challenges. Everyone understands that it's a little bit different. But I think it'll be a lot of one-on-one video things where you can just be yourself and show who you are. I think when I was looking for a program, I think all the information for the academics, what the program's like, a lot of that's available online. And I think when you're interviewing, you're really looking for the personality of the residents and the culture of the program. And I think the programs that you'll fit with, I think you'll still be able to see that via virtual interview. And I think you'll still see resident interactions and kind of be able to hear how their lives are like inside and outside the hospital and get a good sense of it.
I agree. And then looking for someone that's a good cook on the team so they can help keep everybody afloat, I think is a good tip. Awesome.
Yeah, exactly.
Yeah. Dr. Vaysburg, thank you for coming on with us. Everyone, please let us know if you have questions and or anything specific you want to learn about. You can follow him at Chef MD, as he said, so you can pick up some tips. I know I will try to do so. Thanks for coming on with us. We'll see you next time.
Thanks for having me, Betsy.